The title is Time-Dependent Progression of Neurogenic Lower Urinary Tract Dysfunction After Spinal Cord Injury against the Mouse Model. Neurogenic lower urinary tract dysfunction due to spinal cord injury affects both storage and voiding function. Voiding dysfunction after SGI is mainly caused by detrusor sphincter dyssynergia that induces disruption of coordinating activity of the bladder and the external urethral sphincter, resulting in inefficient voiding with increased residual urine. Animal models of SGI have been used to study the DSD condition. However, the adequate timing of evaluation for DSD after SCI in mice has not been explored. In this study, we evaluated the time course changes of the bladder and EUS activity, as well as mechanosensitive channels and L6 to S1 in the DRG, and BDNF expression in the bladder in the mouse model. This slide shows the study design. Female mice were used for the experiment. On day 0, the spinal cord was completely transected at the level of TH8 and 9. After spinal cord injury, perineal stimulation and bladder squeeze was done once a day until the final evaluation. The mice were divided into 3 groups: mice at 2 weeks post-spinal cord injury, 4 weeks post-spinal cord injury, and 6 weeks post-spinal cord injury. Each group underwent single-filling cystometry and EUS electromyography evaluation. After evaluation, the bladder and L6-S1 DRG was harvested for ELISA and RT-PCR. This slide shows the method of EUS-EMG analysis. In the spinal intact mice, the EUS activity is reduced during voiding contraction. However, in spinal cord injury mice, the EUS is tonically active, and EUS activity is intermittently decreased during voiding contraction. The EUS activity decrease can be divided into 2 phases: EUS reduction with notch-like reductions of bladder contraction pressure leading to urination, and EUS reduction without notch-like bladder pressure reduction or urination. We determined only the EUS activity changes causing urination as EMG reduction. Non-voiding contraction was already established at 2 weeks post-spinal cord injury, and the rate of non-voiding contraction did not increase with time progression. However, due to long-term voiding dysfunction and bladder distension, the bladder capacity significantly increased at 6 weeks post-spinal cord injury compared to the other groups. DSD was observed at 2 weeks, but periodic EMG reductions resulting in urination were not observed in most 2-week spinal cord injury mice. At 4 weeks, spinal cord injury mice showed increases of EMG reduction causing urination, which led to increased voided volume. At 6 weeks, spinal cord injury mice exhibited further improvement in EMG reduction and voided volume. However, due to the increased bladder capacity, the voided efficiency did not improve. Protein assay of BDNF in the bladder mucosa, measured by ELISA, showed an increase of BDNF in SCI mice compared to spinal intact mice. Then, BDNF levels showed a time-dependent decrease at 4 and 6 weeks post-spinal cord injury. RT-PCR of L6 S1 DRG showed increase of messenger RNA levels of TRPV1 and ASIC1 to 3 in spinal cord injury mice. ASIC2 and 3 showed a decrease at 6 weeks compared to 4 weeks, while piezo2 showed a slow increase at 6 weeks. As conclusions, differences in time-dependent progression of neurogenic lower urinary tract dysfunction such as DO and DSD are identified in the mouse model of spinal cord injury. The time-dependent progression establishing DSD after SCI may be induced by BDNF overexpression that causes expression changes in mechanosensitive channels such as A6 and piezo2. Thank you for your attention.